Pam and Gloria, thank you for coming into the studios.
Thanks for having us.
Pleasure to be here.
So let's talk a little bit, Pam, about the history. What's the history of this foundation?
Elizabeth Glaser contracted HIV through a blood transfusion after the birth of her daughter, Ariel, and unknowingly contracted the disease and subsequently passed along the virus to Ariel and then to her son, born a few years later. And it wasn't until Ariel was 7 years old and got sick, it took a long time to diagnose, and then the family realized that she had HIV, and so the rest of the family was tested, found that Elizabeth was positive, as well as her son, Jake. Paul Glaser, the father, was not positive. Ariel died, and then subsequently Elizabeth, with two friends, Susan De Laurentiis and Susie Zegan, created the foundation really to be sure that children were kept in the forefront. In those days, certainly in the early 1990s, the focus at that time in the United States was on the gay community and the spread of the disease, and children were barely an afterthought. So Elizabeth created the foundation, and when she died in 1994, many of us have been able to keep that legacy alive by continuing to work with children.
I certainly remember her on television with the family, and one of the things that was remarkable about them was that they weren't trying to hide or even be private. In order to do the work that she did, she had to be very public. What was she like?
I didn't know Elizabeth directly, but I can tell you that I've had a wonderful opportunity to meet and experience so many people who did know her. For example, the foundation does a lot of work in Washington, D.C. in advocating for funding for medications for children who have HIV and for the funding of programs abroad. And I've walked into so many offices of members of Congress and had them tell me about how they knew Elizabeth, and a number of people who remember her speaking at the 1992 Democratic Convention. So a very focused, very strong advocate for children. People said that she was a force to be reckoned with.
Gloria, why did you choose this organization? Of all the organizations you could have chosen to work with, why this one?
Well, I'm not sure if I chose them or if they chose me or if it's a mutual. I think it was a mutual partnership. You know, when I was first on ER and when the storyline that I did at that time through Jeannie Boulay, who was an HIV-positive physician assistant, as is often the case with people that are on television shows, you get invited to support numerous foundations, and that was when I was first introduced to the Elizabeth Glaser Pediatric AIDS Foundation. I remember going to a Kids for Kids event and just going to a couple of other events while I was living here in Los Angeles. But, you know, it wasn't literally until recently. I've been an activist on the issue of HIV/AIDS for quite a few years now, and mostly focusing here in the United States on the issue in the African American and Latino communities because of the astounding rates of new infection and also AIDS having been, being the number one killer of young black women right here in the United States, and trying to bring that into the forefront of people's minds because for some reason there's a lot of complacency about it. But it was earlier this year in New York when I was when Pam and I had met each other at an event that the foundation was having, and we immediately clicked, and it was almost like we'd been friends for a long time, and we just formed this immediate bond, and from that moment we had talked about South Africa and about the possibility of a pending trip, and then a short while after that they so generously asked if I would like to be an ambassador for the foundation. And of course, how could I say no? It's really an honor to be associated with the foundation.
So you recently visited Kenya and South Africa. What stayed in your heart from that trip? Just one small moment.
I try to visit and see and experience our programs in the field. So I was in both Kenya and South Africa, one of the 8 to 9 trips that I make a year to Africa. And a wonderful question you just asked, and I had an immediate visual, what stayed with me. So consider that I go quite often, and I must tell you, I always have those moments that stay with me, no matter the country, no matter how many times I go. And in this particular trip with Gloria, we were in a hospital in South Africa, And as we were standing in one of the lobbies, one of the midwives came out and was so excited. We'd met her earlier in the day, and she said, "You must come back into labor and delivery. One of the moms from the Prevention of Mother-to-Child Transmission Program has had a baby, and the mom is very excited, and the baby is negative, and mom is sitting up, and she'd love to see you." And so Gloria and I went back in, and I must tell you, the joy on the part of the midwives who were there, as well as the mom, will always be with me.
True. It's so true what Pam just said. The joy on her face. It was, I've never seen anything like it. And you know, they're working in a situation that we living in this country would, you just look around and you're like, my God, they are working in these conditions every day and nonstop, and they just, seeing countless things, like women coming in constantly. They go home there after they give birth. They're there for only 2 hours, and they go home. It's unbelievable, unbelievable.
That moment captures the hope that the foundation really focuses on. We know how to prevent mother-to-child transmission. It's why so few babies in the United States are born HIV positive. We have the medicines, we train the people, we know how to do it. Fewer than 200 babies a year are born HIV positive in the United States. Now, we should have 0, but fewer than 200 in the United States. 1,000 babies a day are born HIV positive in the developing countries of the world. But that number's coming down. We know what to do. And so as Gloria and I stood there and watched the joy on the midwives' faces and the joy in that mom's face, it's multiplying that many times in a day, in a week, in a month, and in a year. And we are making a difference.
What do you think about the issue of women's empowerment as a part of, ending the transmission of AIDS? Did you get a chance to ever talk to any women about whether or not they felt like they could make independent sexual choices?
Well, I tell you, the first segment of my trip to South Africa was with Carrie Kennedy and her human rights work. And I believe that both are very much intertwined, the human rights and the HIV/AIDS pandemic in any country. And a big part of that issue is because of the gender inequality and because of the disempowerment that women feel with their sexual choices, with the power to say no. And there's also this element, poverty plays a huge key, because when there is no hope for any kind of job or any kind of future, there's this mentality of a communal mentality sometimes of, well, this gives me meaning in my life. Well, what else would I do other than have a child?
A year ago, we got a call from the White House in Washington, and we were asked by some of the staff of the First Lady of the United States if we might be able to get some children in the United States who are HIV positive to participate in a World AIDS Day event with the First Lady. We work with a lot of families in the United States with children who are HIV positive. And frankly, parents did not want their children who are 8, 9, 10, 12, 13 years old on national TV with the First Lady of the United States, because many of those children have not disclosed in their communities, in their schools, and their parents didn't want them exposed in that way.
If somebody says, oh, I have cancer, then there's huge support around, if somebody says, oh, I'm HIV positive, it's a whole other different thing. And why is that a whole other different response? It shouldn't be any different than any other medical condition.
Do you feel that your celebrity is a force for good?
I think that the true gift of being able to pursue my creative aspirations and to have been blessed enough, to have gained a certain amount of success in that field only leads to it kind of seems like the next thing to do, or part of that whole path, is to use that to try to make a difference, because it is such a gift. It really is to be able to be a creative person.
If you could have a magic wand and just deal with one aspect of the work that you do and fix it forever, what would that be?
Farai, it would be that every child is born without HIV. It's possible. We can do it. We've done it elsewhere in the world. So the magic wand may have some power. We just need to be able to keep it working.